I'm Dr. Michael Latola.
And I'm Megan Strong.
We've got some Valentine love coming your way, a slimy unset polyvinyl siloxane impression, and some good news about sleep apnea. That and more on today's Chairside Live. Welcome to episode 37 of Chairside Live, the Valentine's Day edition. Megan, happy Valentine's Day to you.
Thank you, and you as well. How are you doing?
I'm doing very good. I actually got you something.
Oh, did you?
Yes, I decided to get you
nervous.
something this year. It's an upper molar.
Oh, thank you. Just what I've always wanted.
Sure.
Thanks.
You can go ahead and give me your gift now.
Okay.
Is it a signed picture of you, perhaps?
Yeah.
All right,
It's
I'll
my
wait around for
presents
that.
here today.
And I like your hair. You changed it up a little bit. I like it.
I like your glasses. You've got a new look going for you.
They're, yeah, I feel like I'm wearing them just because I think they had like 10 IQ points to me, which brings me up to an even 100. So we've got an interesting case of the week for you today. It's something we see not all the time, but we see it enough where it's worth bringing up. It's a polyvinyl siloxane impression sent to us from a dentist, and the material, the syringe material at least, is not set, and it's kind of slimy. In fact, you'll need to see it with your own eyes to kind of imagine what I'm talking about. So let's go ahead and take a look at the case of the week now. I was walking through the Crown and Bridge department the other day, and I noticed a case sitting on one of our technical advisors' desks, and it's an interesting one because it's something that we see a little more often than you think we should. And basically what's happened here is that the syringe material that was used around the prep did not set up. And this other material, they're both polyvinyl siloxanes, the rest of the material did set up. And so it makes you wonder what happened. We flip it over here, and again you can see kind of a weird look to that impression. This one looks like it was almost set up as the patient kind of bit into it. It's got this kind of glossy, kind of strange look. Actually, looking at it a little bit closer, it looks that way because that's a partial denture. Everything else here looks okay except for the syringe material, and when we take a look at a couple of the pores of the impression, you can see that that syringe material just literally came off in the stone when this was poured up. And it was, poured up again for, that's the solid model, and it was poured up for the pinned model. And again, you can see that orange kind of syringe material that's actually adhered to the stone, because when the dye stone was poured into the impression, that inner syringe material wasn't quite cured. And so obviously we are lacking a lot of detail when this is poured up because of the fact that that inner syringe material was not solid, and therefore we can't get a good pour from it. So the doctor's going to have to re-impress this. And as we look at it and try to figure out what happened, it's like, well, this was set beforehand, because this appears to have set fine. In fact, even when you come in here and push around on anything here on the yellow material, it's fine. It's really just that orange material where something went wrong. So perhaps it was a two-step impression where the yellow part was taken first with the tray in the mouth, and then the tooth was prepped and then relined with the orange material. So when we start to think about causes of contamination for polyvinyl siloxane materials, we know that the sulfur in latex gloves, and for that matter rubber dams, can inhibit the setting reaction of the polyvinyl. So maybe the yellow did not get in contact with gloves, and maybe the inner material did for some reason, although that's a little hard to figure out. I guess if the doctor touched the prepared teeth with gloves on, we could have had that happening. If that does happen, and you are touching the tooth for some reason, you can just use some hydrogen peroxide to clean that off, to get that sulfur off the preparations and not contaminate the impression. It'll happen sometimes, allegedly, from taking a retraction cord. If your assistant takes retraction cord with latex gloves on and then cuts it, supposedly you can actually transfer that to the gingiva, the one place where it's really important to get this syringe material and have it set well. So if you take a piece of retraction cord and hold it with gloved fingers and then pack it around the tooth, allegedly you can contaminate the polyvinyl. That being said, every tooth that I've prepped and packed cord on in the last, 10 years, I've held with latex gloved fingers and flossed it into place between the teeth. and then packed it into place. And I've never personally had this happen. I've never actually seen this happen on one of my impressions. And so one of the things you'll read is that some of the astringent materials that we use can actually contaminate and inhibit the setting reaction of polyvinyl siloxanes. And you know, I use the Viscostat and Viscostat Plus, Viscostat Clear from Ultranet, and I've never seen this type of thing happen, even though I use it around probably about half of the preps that I do. One of the other things I've seen in the literature is that exposure to residues from temporary materials, such as bisacryls, can actually inhibit the set of some of these polyvinyl siloxane materials. So if you take an impression like some dentists do and then use that impression to make the temporary and then reline it with light body material to take an impression of the prep, that could affect it too. And so, you know, you're going to want to make the temporary after you've taken the final crown and bridge impression. I know some dentists who use a separate impression, but they make the temporary from the prep before they take the final impression, so they can be trimming it while the impression's in the patient's mouth setting. And there's definitely some things that indicate that those type of bisacryl materials can leave something behind that will inhibit the set of these polyvinyl siloxanes. And the last thing that I've seen the finger pointed out as a culprit in cases like this is exposure to air-inhibited methacrylate. So for example, in composites and adhesives, that air-inhibited layer that we have on the surface, if that is allowed to come in contact with these, there are reports that it'll keep a polyvinyl impression material from setting correctly, as we see here. So if you're doing a buildup and it doesn't get prepped, or you put some bonding agent on to form a hybrid layer, you're always going to want to take like a 2x2 or a little cotton pellet with some alcohol soaked on it and rub it on the tooth to get rid of that air-inhibited layer so that we don't have something else that could possibly retard the set of this impression material. So again, this isn't something that happens a lot. We might see 2 or 3 like this per day, and that's out of, you know, thousands of impressions coming in. But it happens regularly enough, and it's really kind of tough to figure out exactly what's happening, especially if it only happens to you 1 out of every 100 or 200 times or something like that. So I wanted to list a few of the causes, a few of the known or alleged causes which might cause this. So hopefully you won't have this situation happen in your own office and won't need to call the patient back for a new impression.
Well, thank you for that, Dr. D. Now we're going to go to a segment we like to call Viewer Mail. This week's letter comes to us from Dr. Howard Ferran, and he writes, "Dear Mike and Megan, I love Chairside Live. I always learn something new." I think that's probably the shortest letter we've ever gotten on Chairside Live. He must be a man of few words.
Howard Ferran has never been accused of being a man of few words, and actually he's made some pretty fantastic contributions to dentistry, and probably the biggest one that most dentists are familiar with is Howard is the founder and CEO of Dentaltown. And Howard approached me with the idea of Dentaltown, or explained it to me before Howard even knew how to use a computer way back in the day. And to me, I really enjoyed computers and I used them a lot, but I had a hard time buying into this vision that dentists all over the country, all over the world for that matter, would come together on this community site and exchange ideas back and forth. Because dentistry at the time was a bunch of dentists practicing by themselves in separate offices, and we really only saw each other like twice a year at dental conventions where we'd get together, and maybe you'd see each other at a continuing education class. So Howard, even though he was computer phobic at the time, had this idea and launched Dentaltown. In the beginning it was kind of slow growing, but now it has grown into this huge online community, and it's been such a blessing to dentistry because there's almost nothing, no problem that you can go there with that somebody else hasn't already experienced and found a solution for. And so you're able to go there, and whether it has to do with root canals or direct place composites or crown and bridge, you can go on and talk to other dentists about it literally all over the world and get some answers and opinions. And it's done for dentistry what nobody else has been able to do, and that's really bring together this body of knowledge, not from a textbook, but practical knowledge that dentists have learned, on-the-job training, if you will, that you can pass on to another dentist. And then they started a whole online continuing education form as well, where you can go take courses as well. And there's a townie meeting that has grown up around it. I'm lucky enough to be speaking at that in Las Vegas this year, where we're all going to be giving TED Talks. So Howard Farran is truly one of the visionaries in dentistry for having the vision to create this online community. It continues to be by far the most popular dental online community. He's got Hygiene Town, he's got other towns besides Dental Town, and it's been amazing. There's been other ones who have tried to do the same thing, but none of them have really caught on, probably because Howard was the first and he's always thought very big about this. So Howard, my friend, I'm glad to have you write in and watch it and learn a little something from us every week if you're able to do that from the case of the week. And I noticed on Dental Town the other night that you are now, in fact, training for your first Ironman Arizona, coming up at the end of this year. So I wish you the best of luck as you go through this long process of getting to the starting line and completing that. I remember last year when you heard that I had done my first and you said it inspired you. I never thought you were going to follow through on it, but much like the idea of Dental Town, you decided to follow through. Really glad to hear it. Thank you for writing in. And Megan, as this week's Letter of the Week, what does Howard win?
Well, of course, he wins the signed autographed copy of You and I.
Very good. And
yes,
it'll come with a dotted line down the middle, Howard, so you can cut my half of the picture out and just keep Megan's picture. That's what we hear most of the people do. Any news for us today, Megan?
Yes. An article published by the San Francisco Gate reveals that the Pro Player Health Alliance, or PPHA, will now test NFL players for sleep apnea and other sleep disorders. The decision comes after football players have died from the disorder. Reggie White was one of those players. Apparently, sleep apnea is rather common among pro football players. The PPHA even screamed during the Super Bowl. In 2009, a dentist helped 25 New Orleans Saints players and made them specialized mouth guards. The Saints won the Super Bowl that year.
And that's why?
Well, I mean, it definitely helped.
Well, it can help. Actually, those mouth guards they're referring to are something that's a little less tested than the sleep apnea appliances. Under Armour makes one, for example,
Okay.
and you put it in, and when you bite down on it, it's supposed to keep your jaws in a relationship where your
Sure.
airway is in fact open more, and no one's really been able to prove whether that works or not. But beyond that, getting the NFL players, all these guys who have the 17-inch necks and who you can
Definitely.
clearly see are overweight by at least a few pounds, screening for that is fantastic. And it's funny because sleep dentistry is not taught in any dental school in the country. So we all graduate not knowing anything about it. And most of us, don't deal with it until a patient actually comes in and asks us about it. But things are changing. In fact, Dr. Gordon Christensen, who's been here,
Yes.
has decided to finally do one of his famous DVDs on snoring and sleep apnea.
Wow.
And I was flattered to have him ask me to be part of it as well, because we do lots of appliances here and we're very familiar with those. So in May, Gordon and I are actually going to be making the first time he's ever made a DVD on snoring and sleep apnea that will be sold to dentists starting in August. And so this really marks another chance and some big inroads for dentists to learn more about this condition. I used to practice with a friend of mine who did a lot of this type of dentistry, and the changes that you make in people's lives are just
Right.
absolutely amazing. In fact, a friend of mine was just telling me that his friend got diagnosed, got a CPAP unit, one of those masks, and absolutely changed his life. He's a whole new person now, and we'd like to think that would happen with dentistry with porcelain veneers, and
Right.
it does from time to time,
Sure.
but this is more than an aesthetic change. We're talking a complete change in the quality of life for the patient. So it's a big deal, and I'm glad to see the NFL is going to do it, because there's kids, all over the country that'll be watching this, and hopefully this will
Definitely.
be something they'll take seriously too. Anything else?
Yes. When it comes to serving in the military, there are many physical, mental, and emotional challenges that our service members face. According to a new study, sleep is one of those challenges as well. Turns out, sleep apnea and insomnia are two of the most common sleep disorders reported among U.S. soldiers with sleep problems. The study examined 726 soldiers, some who had a sleep disorder and others who did not, and they found that 27.2% had mild obstructive sleep apnea, 24.7% had insomnia, and 24% had moderate to severe obstructive sleep apnea. They also found that the soldiers only got, on average, 5.74 hours of sleep per night. The study authors say this suggests the need for a cultural change toward appropriate sleep practices throughout the military.
Wow. I just want to do that.
That was effective.
It seems, well, obviously both stories are about sleep apnea,
Right.
but those numbers were stunning. You
Sure.
know, 27% and 24% have mild, moderate, or severe. And if I quickly do the math, that's less than 100%. So that's about 51% have some sort of sleep apnea in the
Right.
military. And these are the guys who are, and now women, who are going to be going out and fighting for us. You know,
Right.
It's amazing to me that they would have to be so sleep deprived. We just did a sleep study, a take-home sleep study on your
Yes,
husband.
we did.
And you know what it's like to be around somebody who's sleep deprived. They're probably not at their best, I would guess.
Not fun. Yeah, no, and it makes me feel sad for my husband because he goes around throughout the day just so tired because he's not getting the sleep that he needs. And you think in the story, these men and women are sleeping only an average of about, less than 6 hours a night.
Right.
And of those 6 hours, as we know, if they have sleep apnea, they're not getting restful sleep anyway. So I could only imagine how tired they would be and just the effect that that would have on their day-to-day. And then now they're in a harmful situation or a stressful situation, whether they're at war or deployed or whatever it may be, and that just doesn't seem like it would be fun for anyone.
Right. It's like my grandfather used to always say, lack of sleep and automatic weapons do not mix. All right. Thank you, Megan, for that. Appreciate that. That about wraps it up for this week's edition of Chairside Live. On behalf of myself, Megan, and everybody here at the lab, I want to thank you for your time and your continued commitment to quality dentistry.
We'll see you next time. Sorry, I felt like I was about to burp right there. I was like, that would have been awkward on camera. Okay.
That would have been awesome. Perfect blooper, James. James likes to sneak Alka-Seltzer into your water while you're not looking, hoping to bring something up.
Okay.
That was a blooper anyway. That's the ironic part.